Congestive heart failure, also known as CHF, affects many Americans, some of which I personally know and others who have had the opportunity to care for. Congestive heart failure affects all ages and ethnicities, but it is most commonly in elderlies. We'll be discussing some of the causes, signs and symptoms, treatment, and prevention of congestive heart failure. Some of the causes include history of a heart attack and buildup of plaque in the arteries or weakening artery walls, also known as atherosclerosis or coronary artery disease. There are two different types of heart failure. One includes the diastolic heart failure, which is when the left ventricle has an increased pressure of the blood that is not able to pump to the right side of the heart, leading to a backflow into the lungs. This blood is deoxygenated and it goes into the cycle of the heart to get oxygenated and full of nutrients to be able to pump into the body. This leads to systolic heart failure, which is when the right ventricle is not able to pump this oxygenated blood into the body, which leaves or ends up resting in the arms and the legs, which can lead to some of the signs and the symptoms, which include irregular heart rate, congested lungs, dizziness, fatigue, shortness of breath, and a decrease in appetite. The reason why you get fatigue is because that oxygenated blood is not going anywhere in the body. Therefore, you're not having sufficient blood, which leads to a decrease in the energy level that you have in your body, which leads to you being tired. Some of the treatments include diuretics. Diuretics are used to help excrete this extra fluid that is resting in your body. So, as a nurse, what we do to prevent some of the complications is to monitor laboratory work, including BMPs. We also monitor our patient, which leads us to sit our patient completely up to a 90-degree level to help expand the lungs as much as possible. Also, on our assessment, when we initially get our patients, the first thing we do is hear the lung sounds of our patient to determine if it's a right or a left side heart failure. Now, when it is a diastolic heart failure, which is whenever the blood from the left ventricle backflows into the lungs, we put our stethoscope on the patient's chest, and typically what we would want to hear is clear lung sounds. But what we normally get is crackles, which can be kind of like Rice Krispies just coming together, and if you crunch them all together, that's what crackles sound like. And that lets us know that there is a buildup of fluids in the lungs. Some of the preventions that can be done, or we educate as a nurse to our patients, is yearly physical exams to the primary physician of that patient or individual's choice. The reason for that is that the doctor can run laboratory works, and they can also auscultate the heart and the lungs to see if they hear anything abnormal. We also recommend the avoidance of alcohol and tobacco, which can lead to stress on the heart. Another good thing, or good habit to kind of educate, is daily exercise of at least 30 minutes a day. We recommend a walk or a light juggle, or as in light jog or run. We do not recommend anything strenuous, as in climbing a mountain for a long period of time, because if you are an individual that does have heart complications, that can lead to further complications. We also educate our patients to become familiar with certain stress relievers. When an individual gets stressed, they bring a lot of work to the heart. It kind of excites the heart and makes it work a lot. So therefore, if you are a person that does have some complications with their heart and does have certain stress in their life, you're essentially having the heart pump so much that it's like a regular muscle. So if you work it out so much, that muscle is going to become stiff and thick, not allowing sufficient blood to go where it needs to go. So we did discuss a little bit about congestive heart failure, and I hope the most important thing that we need to do is just remember some of the signs and symptoms of congestive heart failure to prevent any complications that you can get with it. Thank you.